So I have 3 objectives today. First, I want to discuss cancer prevention. Then I want to discuss some of the common cancers that affect women. And the last thing I want to talk about is dealing with a cancer diagnosis. So these are some pictures of some women that you might recognize. Over here, I don't know if my pointer's working, but at the top right there, you'll see Christopher Reeves, and the lady standing right behind him is Dana Reeves. She died shortly after he did. She had lung cancer. She was not a smoker. If you go over, you'll see Robin Roberts, the host of Good Morning America. She was diagnosed with breast cancer. And, oh, there we go. She was diagnosed with breast cancer, was treated for that, but later developed a bone marrow failure syndrome called myelodysplastic syndrome, or MDS. And she ultimately underwent a bone marrow transplant and is doing well. Right below Robin Roberts, you see Wanda Sykes, the comedian. She had breast cancer and had a double mastectomy. If you go way over to the other side, you see Angelina Jolie. She actually has a breast cancer gene that predisposes her to cancers of the breast and the ovary. So she had something that we call a prophylactic mastectomy. That just means that she had both of her breasts removed before there was any evidence of cancer because her cancer risk was so high. And I anticipate that she probably will undergo a hysterectomy with her ovaries taken out. Right by Angelina Jolie, you all will see Eartha Kitt. Y'all know Eartha Kitt, right? So Eartha Kitt died of colon cancer. Right above Eartha Kitt, you'll see Yvette Wilson. You may not recognize her, but she was in Moesha. Y'all remember the show Moesha? Yeah, she died of cervical cancer. And you probably can't see this guy. I put one guy in there because I knew this audience would have some men in it. But y'all remember Shaft, right? Yeah, Shaft had breast cancer. So the reason why I put him up there is to remind the men in the audience that you can get breast cancer. So if you notice something abnormal, you need to talk to your doctor about it. All right, there we go. Okay, so what should I know about cancer? So first, let's talk about what cancer is. Cancer occurs when you have an abnormal division of cells. So you have cells throughout your body. You have hair cells, you have skin cells, you have colon cells, breast cells, ovary cells, all kinds of cells. And God designed the body so perfectly that the cells are balanced. There are genes that tell cells to stop growing. There are genes that tell cells to divide. And cancer occurs when there is something abnormal, mutation that happens, where the cells just grow uncontrollably. And so sometimes those cells will grow in one spot and it'll be localized, but sometimes those cells will spread out throughout the body. And that's something that's called metastasis, when cells go from the first location and then spread to other locations. All right. So, what are the most common cancers diagnosed in women? In the United States, breast cancer is the most common cancer that's diagnosed in women. That's followed by lung cancer. And then after that would be colon cancer. If you see this little area, that little gray area on the other side, that includes all the other cancers that women have. So there are hundreds of different kinds of cancers. But the 3 most common are breast, lung, and colon. Now, breast cancer is the most common cancer that women are diagnosed with, but lung cancer is actually the most common cause of cancer death in women. Okay? Let's see. There we go, there we go. Okay, so what's cancer's effect on women? Sadly, 1 in 3 women will be diagnosed with cancer in their lifetime. Even worse, 1 in 5 women will die of cancer. So what are some things that we can do to prevent cancers? It's estimated that 1/3, or 33%, of cancers can be preventable. I think some of the speakers before me touched on some of the things that we can do. But first, you got to stop smoking. If you smoke, I understand it's addictive, but we have to stop. It is one of the easiest things that we can do to reduce our risk of cancer-related mortality. The next thing, alcohol. People who abuse alcohol are at risk for many types of cancers. Cancers of the head and neck, cancers of the liver, the esophagus, the colon. Even women who drink a lot are at an increased risk of breast cancer. So those are easy fixes, right? Now, obesity. Obesity can cause head and neck cancer, breast cancer, pancreas cancer, kidney cancer, colon cancer, endometrial cancer, rectal cancer, to name a few, right? So what is obesity? Obesity, the definition of obesity is if your body mass index is greater than or equal to 30. So I know all of you have your smartphones. Y'all can Google BMI and come up with a BMI calculator. And as I'm talking, you can see what your BMI is. It's a measure, it's a calculation of your height and your weight in adults. And 50% of black adults are considered obese. 77% of black adults are considered overweight. And so not only can obesity cause cancer, it can cause heart disease, stroke, sleep apnea, heartburn, high blood pressure, knee problems, okay? So this is a quote from Cliff Hudis. He is our president of our National Cancer Society. And he said, obesity is on its way to replacing tobacco as the #1 cause of preventable cancer death. That's serious, okay? So what can we do? Don't worry, we have answers, right? We can decrease our risk of cancer death by, one, exercising. The American Cancer Society recommends that you should have at least, I'm saying at least because you can do more than that, at least 150 minutes of moderate intensity exercise. So what's moderate intensity exercise? That's walking, that's gardening, that's doing simple things, bicycling, but not going real fast. Just simple things, get off the couch, you know. Or you can do 75 minutes of vigorous intensity exercise. So that's running, right? So if you have a treadmill while you're watching Real Housewives of Atlanta, right? You can run, or while you're watching Scandal, right? So that's you can hike uphill. That's considered vigorous intensity exercise. That's swimming laps in the pool. All of those are considered vigorous intensity exercises. The other thing is, I know one of our speakers said that you can have 5 cups of fruits and vegetables. And you know what? Let's go with her. The American Cancer Society recommends 2.5 cups. But you can go up to 5 cups of fruits and vegetables a day. The more fruits and vegetables you eat, the better. The more fiber you have, actually that decreases your risk of colon cancer. It's better to eat whole grains instead of refined grains. And I liked her palm method for limiting your consumption of red meat, right? Right. I saw it. I like that. That's a little piece of meat, isn't it? That's a little piece of meat. I know it. But if you eat more fruits and vegetables, then you can eat the little piece of meat, right? Okay. All right. So now what else can we do to prevent cancer? Now this might not apply to everyone in the audience, but vaccinations. There are some people who work in professions where you might need like a hepatitis B vaccination, or if you have had high-risk behaviors. And do y'all know what I mean by high-risk behaviors? Y'all do? Y'all know? Or you don't know? Okay, because I'll tell you if you don't know. High-risk behaviors, high-risk sexual behaviors can increase your risk of hepatitis B. So hepatitis B can cause cirrhosis, and that can cause liver cancer. So when you talk to your doctor, you want to say, hey, should I get a hepatitis B vaccine? The other thing, this is something I really wanted to talk about. HPV. Have you all heard of HPV? Yeah. HPV is human papillomavirus. That's the virus that causes genital warts. It can also cause cancers of the genital area and of the mouth, okay? I have seen a lot of young people who participate in certain activities who come with cancers of their mouths, okay? It's something that we don't talk about very much, but we should. So, a couple of years ago, they came out with the human papillomas vaccine. And it's recommended that if you are 26 years and younger, that you should get this vaccine. Now, I'm not 26. Some of you might be 26. I'm not 26. But if you're 26 years and younger, you should get this vaccine. We think that it will help prevent cancer, but we need more years to figure it out. But we do know that the vaccine does help to prevent the human papilloma virus. Okay? Got it? What else can we do? Sunscreen. I know when I grew up in Louisiana, we never bought sunscreen because my mama said black people don't get skin cancer, right? They don't as much, but there's still a risk. So when you go out in the sun, especially between the hours of 10 a.m. and 4 p.m., you want to use sunscreen. And so you go to Walmart and you say, I don't know what sunscreen to get. As long as you get something with a sun protection factor or an SPF factor of 30, that's fine. They have some that are expensive that are like 100. If you get one that's at least 30, that will block 97% of the UVB rays that can cause some types of skin cancer. So SPF of 30, when you go out in the sun, don't go out in the sun naked. Put on some clothes. Put on your hat, your glasses. If you're going to be out in the sun for a long time, you may even want to wear long sleeves. Okay? Those are easy things that we can do. So what's the bottom line? And what's considered obese? BMI 30 makes us sad, doesn't it? Protect yourself from the sun. Talk to your doctor about getting immunized. And we're going to avoid risky business, okay? All right, so those are things that you can do to help prevent some cancers. But what can doctors do to help you decrease your risk of getting cancer or to find cancers early? So we actually have good screening programs for breast cancer, colon cancer, cervical cancer, and skin cancer. I didn't include prostate cancer because I know my buddy Dr. Stewart is going to be here in a couple weeks to talk about men in cancers. So, you don't have to raise your hand. You can think about it. How many of you are 50 years old and older? I said you didn't have to raise your hand. I just said think about it. All right. So all of you who are 50 years old and older, you should have a colonoscopy, okay? If you have average risk for colon cancer, so what's considered average risk? Average risk means that your brother, sister, or your mommy and daddy did not have colon cancer, because then you might need to get a colonoscopy earlier. But say no one in your immediate family had colon cancer, or you don't have a history of something that we call inflammatory bowel disease, that's like Crohn's disease or ulcerative colitis, then you probably need to get a colonoscopy earlier. But if you have average risk, meaning no one in your immediate family had colon cancer, and you are 50 years of age and older, you got to get a colonoscopy. Okay? We're going to talk about that a little bit more. Mammogram. We're going to think about it again. How many of you are 40 and older? and you're in good health. So there's been a lot of controversy about mammograms. And I almost hate to watch the nightly news because once a week they have a new study that comes out with breast cancer that gets everybody confused. So, particularly for women of color, you should get your mammogram starting at age 40. So the American Cancer Society recommends that you get a mammogram starting at age 40. There was, the United States Task Force came out with some information a couple years ago that said that you should start at 50. So the reason why I'm telling the people of St. Peter's to start at 40 is because women of color do not do as well with breast cancer. So we need to do the best that we can to try to get these mammograms. And you want to get them every year because I have seen many women who are taking care of the kids, taking care of mommy and daddy, taking care of everyone else, go a couple of years without getting a mammogram, And you know what happened, right? Because they had to come see us, okay? Now, Pap smear. So the reason why we do Pap smears is because cervical cancer is almost, you see the picture? Cervical cancer is almost 100% preventable. I'm not going to say it is 100%, but it is the most preventable. This is the best screening test we have. People should not die of cervical cancer in this day and age. So if you are between the ages of 21 and 29, you should get a Pap smear at least every 3 years. If you're between the ages of 30 and 65, then you should get it every 5 years. If you're over 65, praise the Lord. Praise the Lord. Praise the Lord. All right? All right. Now I want to talk to you. You've done the best that you could. You were, jogging on the treadmill while you're watching Real Housewives. You ate that little piece of meat that they told us to eat. You've done everything right. And sometimes it still happens, okay? Sometimes you can still get cancer. And so I wanted to go through what happens if we suspect cancer, and then we'll talk about some of the cancers a little later on. So the first thing, if we suspect that something may be going on in your body, we usually will do a PET scan or a CT scan. So a PET scan is a scan where they use radio-labeled glucose, and the sugar is taken up by the cancer cells, and we're able to see on a scan spots that light up. It literally lights up like a Christmas tree, the areas of cancer. Or if you see in this picture, this is actually a picture of a CT scan. And you'll see the liver, that's the liver right there, there's a spleen right there. And we use that to evaluate where all the cancer could be, okay? So if on a scan we see something abnormal, then we do a biopsy. We always need a biopsy to tell us what kind of cancer it is. Because like I said, there are hundreds of different types of cancers, and we treat cancers very differently. Sometimes there are people who may need to have more than one biopsy. So the majority of the time we need a biopsy to confirm a diagnosis. And so once we have a biopsy that says what this is, we've done scans. One thing I didn't mention is that sometimes we also do bone marrow biopsies depending on what kind of cancer it is. I treat more blood cancers, and so if you come to my clinic, most people get bone marrow biopsies. So the one thing that you always want to know, what stage? And what does stage even mean? I know everybody knows stage 4 cancer. But there are lots of stages of cancer. So there's actually a stage 0 disease. There are some people who have, it's not really cancer yet. You can actually have a stage 0 cancer. And that means that it's just in one little spot. The higher the stage, the more likely your cancer is in more than one location. And so stage 4 is considered the most advanced stage of cancer. So remember I told you the 3 most common cancers in women: lung cancer, breast cancer, and colon cancer. I wanted to start with lung cancer because more women die from lung cancer than colon, breast, or prostate cancer combined. It's something that I don't think we talk about nearly enough. So this is just a cartoon, and you'll see this little ball, these little balls right here. That's what lung cancer looks like when we go through scans. So what are the symptoms of lung cancers? There are some people who have a cough that won't go away. Now, if you have a sinus infection and you're sick, okay. But we're saying a cough, that persistent cough that really won't go away. Or there are some people who come in coughing up blood. Now, you shouldn't be coughing up blood, all right? So if you're coughing up blood, you probably need to go to the emergency room. Now, if you had a nosebleed, that's something different. But if you are truly coughing up blood, you need to go to the emergency room to be seen. Wheezing, pneumonia, and this is a chest x-ray right here. It doesn't project too well, but you'll see if I were looking at this chest x-ray, I would say, what's going on down here? We need to look into that right now. Okay? Now, in the last 2 or 3 years, there have been some studies that come out that show that We have actually effective screening tests now for lung cancer, and that's actually pretty good because this is tobacco country. Think about it. If you are 55 years of age and older, you don't have to raise your hand. If you're 55 years of older and you smoke a lot. Now, what does smoke a lot mean? Usually if you smoke a lot, you know you smoke a lot. But, you know. But our definition of smoke a lot is if you smoke a pack per day for 30 years. Okay? That is a lot, right? But even if you haven't smoked as much, you need to talk to your doctor about potentially getting screened for lung cancer. And the way we do that is something called a low-dose CT scan. So it's not as detailed as some of the CT scans that we may do if we're looking for other things. This is just a screening test. A low-dose CT scan done every so often will help us to see lung cancer earlier because advanced lung cancer we can't cure. My grandmother actually died of lung cancer. So advanced lung cancer we can't cure, but early stage lung cancer we can. So the earlier we catch it, the more likely you are to survive, okay? Now, Dr. Lamar always wants to tell you the truth. There are some insurance companies that are not covering these CT scans. And so you want to talk with your doctor to see if your insurance company covers it. If they don't, and you know you smoke a lot, you may still want to get it, okay? Because it really is important because you can actually be cured if lung cancer is caught early. Breast cancer. So what are the symptoms of breast cancer? Historically, breast cancer is a painless lump in the breast. So sometimes you can have tender areas in your breast. The majority of the time, breast cancer is a painless lump in your breast or sometimes in your armpits, okay? Other symptoms of breast cancer, if you have change in the shape of your breast, or if you start to have nipple discharge and you know you shouldn't be having it, right? You didn't just have a baby. Or change in the skin of the breast. So you guys know what an orange is like, and you know the texture of an orange. Sometimes people with breast cancer, their skin, the skin of their breast can start to feel like an orange peel. And we actually have a fancy name, peau d'orange is what we call it. And so that's something you really need to talk to your doctor about. And this is a mammogram. So when you have a mammogram, this is what we're looking at when we see it. Okay? Now, I wanted to go through the steps. If you notice, you know what, I think I have a breast lump. What do? You talk to your doctor, you get a mammogram. There are certain criteria that the radiologist uses, and if it looks suspicious, the radiologist will say, you know what, you need to come back. We want you to come back. We want to get a better test, and we want to do a biopsy, okay? So if you get a breast biopsy, that tissue is put on microscope slides, and then the pathologist will take a look at it under the microscope. They're looking at a lot of things, but two things that the pathologist is looking at is this invasive? Because if it's invasive, that means it's cancer. And is it hormone positive? So breast cancer has 3 hormones associated with it: ER, PR, and HER2/neu. I don't expect you to remember that. The reason why it's important is that now we have drugs that can target those hormones, okay? So after the pathologist looks at it and tells us, you know what, I think this is breast cancer, it's either triple negative, meaning there are no hormones associated with it, or it's hormone positive. There are different things that can be done. There are some people who have surgery where they have the breast removed. Some people have both breasts removed. Some people just have the tumor itself removed, and a lot of times that will be followed by radiation. Depending on the stage of your cancer, you may also get chemotherapy. And lastly, if your tumor showed signs that it had the hormone receptors on it, then you would also take hormone therapy drugs targeted against that ER, PR, or HER2/neu. Okay? Now, colon cancer. So, symptoms of colon cancer, a lot of times we'll say, do you have any change in your bowel habits? And then people in clinic will say, well, what does that mean, right? So if you go to the bathroom, I'm talking about bowel movements here, okay? So if you go to the bathroom every day, and then all of a sudden you're not going every day, okay? Or if you know that your stools used to be a certain size, and now they're the size of pencils, those are considered changes in your bowel habits. Now, the other thing that can be associated with colon cancer is blood in your stool. Now, you don't have to raise your hand, but when you go to the bathroom, how many of you look to see what's in the toilet? You don't have to raise your hand. You don't have to raise your hand. Don't raise your hand. Don't raise your hand. If you get nothing else from this talk today, I want you to remember that Dr. Lamar said to do this. I need you to look, okay? Because you need to know. There's no way. You can't tell me if you come see me in clinic and I say, do you have blood in your stool? And you say, I don't know. Then I know you haven't looked. All right? All right. So we're going to look because if you have blood in your stool, that's a problem. Now, I know some people are saying, well, I have hemorrhoids. You need to get your hemorrhoids fixed. But, yeah. I'm going off topic. So the other thing that can happen with any cancer is weight loss despite eating the same foods. You're like, you know what? I'm actually not exercising. I'm just losing weight, and I'm not trying to. That's something that we call unintentional weight loss, okay? Colon cancer can be 90% curable if it's caught at an early stage, okay? So it's really important. Remember we said if you're 50 years of older, average risk for colon cancer, you need to get your colonoscopy, and then you need to get it every 10 years. 90% of people can be cured if it's caught early, okay? And most insurances will cover colonoscopies. So we've talked about prevention. We've talked about things that you should do and you shouldn't do to help reduce your risk of cancer. We've talked about, you know what, if I'm concerned that something may be happening in my body, the processes that take place from a medical standpoint. But these are some other things that I run into actually every day with my patients. So before there's even a terrible diagnosis that occurs, I'm not saying it's going to happen, but you always want to be prepared, okay? Because there's a certain level of comfort that comes in knowing what you already have. So if you do not have health insurance, I beg of you to get health insurance. Find people who can help you get health insurance. You really have to have health insurance in today's day and age, okay? And not only health insurance, you want to know what your health insurance covers, because there are a lot of people who like, oh, I just got the first policy, and they're really underinsured. I can't tell you how many fights nice Dr. Lamar has with insurance companies because they won't cover simple things like nausea medicine for chemo. I'm serious. This is sad. Okay, so you really want to make sure the health insurance that you get, know what's in the policy, okay? You also want to know your employer's policy. So if you get sick, what are they going to do? Do you have disability with your job? Do you have short-term disability? Do you have long-term disability? How difficult is it for you to get? Okay? Now, this is really important. Advanced directives. Do y'all know what that means? I didn't know what it means what it meant when I first heard of it either. So, advanced directives. What would you want if you were in a situation where you could not make decisions for yourself? So, a lot of times we don't like to talk about what would happen at the end. It was even a struggle talking to my parents about what they would want, okay? Because they say they don't want nobody pulling the plug on them, right? But what does that mean? What would you really want if you weren't in a position to make decisions for yourself? Who would you want to designate to be able to make decisions for you? This is a decision. This is a conversation that you need to have at lunch today because you're eating a little piece of meat, so you're going to have time to talk, right? Would you want, if you were in the hospital and you essentially died, would you want us to bring you back to life? These are conversations that you would want to have with your family members, okay? So when it comes time, everyone's on the same page, all right? And power of attorney, that just means that you designate someone to make decisions for you. All right? Now, so what happens? What happens if you're diagnosed with cancer? So you'll be referred to an oncologist. An oncologist is just a physician that specializes in cancer. All right? I'm an oncologist. Sometimes you hear the word hematologist. That's also a physician that specializes in blood and blood-type cancers. I'm a hematologist. So after you go to the cancer doctor and they tell you, the plan, sometimes you want a second opinion. And I didn't really appreciate second opinions until I started giving them myself. So I have a lot of people who come to me from other places, and they say, this is what my doctor said. Sometimes I agree with the doctor, sometimes I don't. And sometimes I change the plan altogether, okay? And I never really appreciated that one pathologist can look at a tumor and say one thing, another pathologist can look and say something else, okay? I think the people in Winston-Salem are actually pretty blessed because you have good pathologists, but if something is telling you, you know what, I need someone else to take a look at this. I just don't feel right. Get a second opinion. Most insurances will cover a second opinion, okay? Now, I listed the American Cancer Society because they are actually really helpful, but we have the cancer agencies in the back that would be good because they're local that you can get plugged into. So there's no reason if you have a cancer diagnosis, there are resources here, and there are lots of resources in North Carolina, okay? Way more than my people in Louisiana have. So you really are blessed with the medical resources that you have here. Now, one thing that I didn't mention with health insurance, and one of the reasons why you really want to have health insurance is because cancer care is expensive. It is incredibly expensive. I have some people where the drugs that I prescribe cost $10,000 a month. Right. There are some treatments that easily cost $100,000. Okay? Bone marrow transplant, easy, $100,000. Okay? And I can't afford that. Right? So you really, really, really want to make sure you have health insurance. Okay. Now, say you have this diagnosis. Then what? Keep your records. If someone tells you you have cancer, say, okay, you want to see that on paper. You want to know what kind of cancer you have. So when Hurricane Katrina happened in Louisiana, records were lost. So people were going to Houston. They didn't know what kind of cancer they had. They didn't know what they were treated with. They didn't know if they had surgery, they had radiation, they had chemotherapy. You have got to know what people are doing to your body, okay? And so you may not be able to pronounce the words. That's okay. Just keep your information in a folder, okay? You're paying for it. I told you some of this stuff costs $10,000. The least you can do is get a sheet of paper, right, that has your diagnosis on it. And so if you've had a biopsy done, you want to get a copy of your pathology report, okay? So you know, okay, so this is what I had. You want to get a copy of your CT scan report. If they say you have cancer here, you want to see on the report that it shows that you have cancer here, okay? That's you being active in your medical care. And physicians appreciate it. I like when people are like, Dr. Lamar, they said it was right here. I'm like, you know what, you're right, okay? You also want to know your treatment plan. If someone is giving you radiation or somebody's giving you chemotherapy, how often are you getting it? When do you need to be here? What do you need to do with your family? You need somebody to drive you, okay? Okay. So this is just something about clinical trials, because I am the principal investigator of a lot of clinical trials at Wake Forest. Clinical trials are near and dear to my heart. It is because of clinical trials that breast cancer is not the leading cause of death in women, because there are thousands of women who are willing to participate in trials. That's why when somebody comes in with early stage breast cancer, our anticipation is cure, okay? Particularly in the minority populations, historically, we've had some problems with clinical trials, right? I mean, I'm from Louisiana. Tuskegee, Alabama is not that far, right? So we all remember those things that happened. But it's because of clinical trials that we found cures for diseases. And so you also want to talk to your doctor about clinical trials, because there are some trials that we have open at Wake Forest where people are getting the standard therapy that I would normally give, except they get it for free. Okay? You may not participate, but you may just want to know what other options are out there. Okay? The other thing is that a lot of times the literature that I use to make treatment decisions for patients, there weren't a lot of minorities in those trials. So even though I say, I quote you, you have this percentage of doing well with this, it's not really based on your race a lot of times. Okay? And honestly, a lot of the trials are done in Europe. And so when things come to America, we have to change sometimes dosages because our diets are different. We don't metabolize medicines the same way. Okay? So it's real important. Just ask your doctor. You don't have to participate, but sometimes it's helpful. This was just a plug for Best Health. I know they're in the back, and I think Courtney already talked with you. They have health seminar screenings, cooking classes, and you can talk with them in the back. Faith Health is also back there. All right, y'all, I'm getting towards the end here. Stay with me. So this is a plug for Wake Forest. So we just built a new cancer center. This top picture is the courtyard of the new cancer center. That's actually inside the building. And this bottom picture is one of our floors where some of our patients are. Remember that Wake Forest is the #1 cancer hospital in the state of North Carolina, and it's ranked number 12 in the United States. Okay? All right? Thank you so much for letting me talk with you.
We didn't prepare for this. For us, if you could get a couple mics, we're going to give place about 10 to 15 minutes for Q&A. I'm sure there will be some questions, and we have the expert here to answer any questions. If we get a couple mics, one on this end and one over here. If you have a question, please reframe your question to at least 2 minutes. If you could come down here.
And I won't charge.
She won't charge you for it. But if you have some questions, this is a good time for it. There's a mic here. Here's a mic for this side over here, and one for right here. There's no such thing as a bad question. We'll start with you, Flora.
Good morning.
Good morning.
Good morning, doctor, and thank you for all the valuable information that you provided this morning. Thank you for all the valuable information that you provided this morning. My question is, I have two young adult daughters, and I can honestly say they are not sexually active. Why would they need to get that HPV vaccination?
That's actually a good question. Even though that's the case, 80% of young adults get the HPV virus. 80%. There are a lot of people who clear the virus. So not only is sex a risk factor for it, even kissing, okay? Any type of contact. And so really, if this can be prevented, and there aren't really side effects. I know the HPV vaccine has been incredibly controversial, but the stats are the stats. Most young people most people actually will have this virus. The thing is that most people clear it. It's those people who don't clear the virus that can end up with warts and even the oropharyngeal cancer. I'll tell you, the people that I've seen in clinic with oral cancers, these are not people who are out there. These are professional people who you would least expect. Okay, so I'm not saying anything, but you know, it's always a judgment call. But, you know, 80% is high.
Dr. Lamar, I have 2 questions.
Okay.
Brief, I promise. When you talked about lung cancer and you said wheezing, a lot of people have asthma. Is that a prerequisite to cancer?
No. Asthma is not a prerequisite to cancer, and really, the symptoms are really nonspecific. A cough, I mean, everyone has a cough from time to time. Cough in the blood, most people don't have. Wheezing, pneumonia, those things happen. So asthma is not a prerequisite to cancer. Okay?
Second question. I'm a 2-time cancer survivor.
Congratulations.
Thank you. Mine is thyroid cancer,
Okay.
Which is kind of rare.
Right.
When I had my second radiation treatment,
Mhm.
which was larger than the first,
Mhm.
I was told that over your lifetime you can only take a certain amount of radiation.
That's true.
But no one has ever been able to tell me what that number is. So how do you keep track of that if it were to come back? Not that I'm claiming that because I'm not. I'm healed.
Right. Right. So what you're saying, you had radioactive ablation? Is that what you mean by when you said RAI with the pill and the?
Treatment with the pill.
Yeah.
First
Yeah.
was like 80 m something.
Right.
The
Millicurie.
second was 100 MC something, whatever.
Yeah. You know, it's hard because the reason why we get nervous about radiation, it's actually from some of the World War information from the
Right.
atomic bomb data. And so we extrapolate a lot of the data from that because a lot of people 20 years afterwards, they were developing leukemias and solid tumors.
Right.
And so we really don't know. We just know you shouldn't have a lot of it. And with radioactive ablation, that is a little different than traditional radiation because a lot of times with traditional radiation, the radiation oncologist will say, you know what, that's enough. But I don't know what kind of thyroid cancer you've had, but there are new drugs that have come out that look very promising in that arena. And so a lot of thyroid cancers are pretty slow growing, as you know. So I really wish you the best.
Thank
really
you. I appreciate that. Thank
Okay.
you.
Okay, my question is, I had a miscarriage back in '95,
I'm sorry.
and from the age of 33, I have been having mammograms. I don't have breast cancer. I don't have any type of, I'm lactating, like I'm still breastfeeding.
Uh-huh.
And my recent mammogram, which was in September.
Uh-huh.
And
So why are you having mammograms and not MRIs?
Because they did the digital mammogram on me, and breast
So
imaging.
is this your primary doctor that's prescribing
For me to have the
mammograms?
mammograms.
Mhm.
Yes, and my own concerns because since '95, I mean, I have had children after
Right,
that,
right.
but my youngest is 10 and a half,
Yeah.
and I nursed him until he was 2,
Uh-huh.
and I'm still.
You're still. I would actually have you go
know.
see an endocrinologist.
Well, I've seen one
And
of those too.
what did they say?
I'm just lactating. I
Uh-huh.
mean, my milk ducts are diluted, so basically speaking, I have to stand in the
Yeah.
shower to let it
Uh-huh.
drain.
So if you're 33, I actually wouldn't
I'm
have
not
to-
33. I'm
Oh,
45.
you're
I've been
45.
having this since I was 33.
You've been having it since you were 33. I
yeah,
see.
and I've had kids in between.
Uh-huh.
So it's like I don't know if I have a what is it, over thyroid or pituitary type.
There are some people who have pituitary abnormalities that can cause
Right.
that to happen.
Yeah, because I'm still breastfeeding like I got a baby. You know what I'm saying?
Uh-huh.
Not to be, you know.
And they
But
haven't
it's-
given you pills to help?
No, none of that.
Okay, we can maybe talk a little bit afterwards.
Okay.
Okay.
Thank you.
All right.
Good morning. I have a question concerning breast cancer.
Okay.
It's in far as cysts are concerned, the staging that you was speaking about. What is zero staging in cyst or to the tumor?
Okay, so you have fibrocystic breast?
I've had the mammogram and the sonogram, not the biopsy, but the cysts.
Yes,
are present.
cysts are not considered cancer.
So the
Cysts are not considered cancer. So there's something that's actually called ductal carcinoma in situ, or DCIS. That's actually a stage 0 breast cancer. So
okay, that's what I'm mistaken.
yeah, so you do not have cancer.
No.
There are many women who have fibrocystic breast disease, and another name for that is lumpy, bumpy breast. And there are some people who even have benign breast tumors, but that's not considered cancer, and we would not treat that.
Well, the doctor told me that the cysts were like, just leave them alone, nothing to do with that. But it just seems.
I'm sorry, I can't hear
She
you.
said that they're cysts, but leave them alone. There's nothing to do with that. It just was like
That's
not enough
correct.
information for me, though.
Well, there actually aren't things to do with the cysts. Having fibrocystic breast disease slightly increases your risk of breast cancer, but I would just recommend that you do normal breast cancer screening.
Okay, thank you.
Some people who are young with fibrocystic breast, then we have to maybe use MRI and a mammogram to be able to see their breast. But I actually agree with her. There's nothing that I would recommend that you do.
Thank you.
Well, praise the Lord.
Praise the Lord.
Doctor, I would really like to know something on constipation. It's a thing where you go normal, but then the next day you're in little pills.
Uh-huh. How long has that been going on?
I say about 6 months,
Uh-huh. And you've had your colonoscopy?
but it's gonna be September.
You had it, and it was fine?
I had it last year, but I'm having another one. I just went to my doctor this Friday,
Uh-huh.
and he said everything is okay, but I didn't tell him what I'm just asking you this question about the constipation.
Now, so I want to make sure I understand you. So this is new constipation that you're having,
Yes,
and you hadn't changed anything with your diet?
I probably have. I don't eat a big meal but once a day.
You don't eat a big meal once a day. So one thing that you can do, because you said you were having the pebbles, increase your fiber intake. Fiber actually helps to bulk your stool. There's something you can get from Walmart called Benefiber. You can put it in your coffee or put it in your drink, and that can actually help to bulk your stool. Don't overdo it, because it may give you a little gas, and it may make it too big where it's hard to come out. So try that. Pay attention to what you're eating. Okay, because it seems like you're up to date. It seems like your doctor's on top of everything.
Okay.
All right?
Yes, good morning,
Good
Bishop
morning.
and Lady Joyce. Good morning, Dr. Lamar. 7 years ago, I was diagnosed with breast cancer stage 3B. And prior to that, 10 years prior to, I had started having mammograms because my mother had also been diagnosed with breast cancer 5 years later after taking tamoxifen, had died with recurrence. So anyhow, I was diagnosed, like I said, 7 years ago, stage 3B, ductal inflammatory. And that August, because that's when I always had my mammograms, everything was clear. There was nothing. Okay, and then in October 2007, that's when they found the cancer, stage 3. Well, it started off actually, like I said, inflammatory. My breast was...
So what she's describing, inflammatory breast cancer, is actually not as common. Sometimes that can present with redness of the breast, and actually it sometimes even takes a while to be diagnosed. This is something that we really can't pick up as well on mammograms, because it's the skin changes in your breast that should clue you that something is going on. And it's actually, it grows pretty rapidly. So she's telling you that in the span of a couple of months, she went from nothing to something happening stage 3B. So that's actually pretty advanced stage.
Yes.
I'm sorry, I cut you off.
But that's okay. Thank you for explaining that to them.
Yeah.
Because even though I'm in the medical field, I'm a family nurse practitioner, I was in an awe, that it occurred actually.
That quickly.
Yes, within a matter of 2 weeks, my
Right.
breast was double the size of the other.
And that's exactly the
Inflamed.
way it is.
It had
Yes.
the orange peel
Yes.
appearance to it.
Uh-huh.
But my main concern, of course, is I have 2 daughters.
Yes.
My main concern is them. Now, should I go ahead and have them done for testing? What would you suggest?
I would suggest that you, when she's talking about testing, she's talking about genetic testing, like for the
Yes.
BRCA mutation that Angelina Jolie had.
Yes.
I would, because if there is a genetic problem, I mean, we can prevent it about 85% of the time.
And
And so, how old was your mom?
my mother was 40. She was
Yes,
probably about the same
yes,
age I was. She
yes.
was about 45 when
You
she
should
was
get tested.
diagnosed, actually. Yes. So,
Congratulations on being
thank
a
you
survivor.
so much. Thank you.
Hi.
Hello. I just wanted to know, like, I've heard a lot of things about pap smears. Like, there are various, like, when you should get it, if you should get it. So if you're not sexually active and you've never been sexually active and you're under 21, should you still get a pap smear?
No. Yeah.
Thank you.
So then I would recommend that you start at 21.
So start getting pap smears at 21, even if I'm not sexually active.
Yeah.
Okay.
And it's only every 3 years. Remember, you can do it 21, 24, 27.
Hi, thank you for the informative information. I am a cancer survivor.
Congratulations.
In fact, I just finished my treatment this past Friday.
Congratulations.
Well, thank you. Thank you. But most of all, I really thank God, you know.
Yeah.
I thank my pastors for praying and the
Yeah.
saints that prayed for me. But my question is that I asked the doctor, why do you have to have radiation and chemo alternated?
Now, tell me what kind of cancer you had.
Uterus.
You had uterus cancer.
Mhm.
Okay. So,
See, what they did, they had me schedule three times I'm to have chemo. I was to have chemo. 5 times I would have radiation and alternate till it was
Yep.
completed. But I couldn't take the chemo. I had 2, and I had a reaction. I'd end up in intensive care
yeah,
because of
you
it.
had a Taxol reaction or a carboplatin reaction? Yeah.
I don't know. All I know, they had to put a tube,
Yeah.
a drainage tube in me and all. I was in intensive care for 10 days.
So let me tell you why we do chemotherapy and radiation. So
Yeah.
chemotherapy is medicine that goes into your bloodstream. Chemotherapy is used for what we call systemic disease. So when we do chemotherapy, we're trying to get cancer throughout the body. When we do radiation, think of spot welding. We're trying to decrease the risk of the cancer coming back in that particular area. So she probably had abdominal radiation.
I did.
Yeah, and so we want to decrease the risk of it coming back in that area right now, but we also need to treat the rest of your body. And so that's why chemotherapy and radiation sometimes work together.
Oh, okay. Thank you.
All right.
But you know, they say, I asked them why. They say it's a preventive. So there is no sure thing of anything. You just take it. You take that chemo, you take the radiation as a preventive, right?
So the reason why they use both with your particular disease is because there have been studies that have shown that the combination of chemotherapy and radiation versus chemotherapy alone or radiation alone is better. And so there were people who participated in clinical trials, and that let us know that this combination is better than doing those things by themselves.
Okay, then. Thank you very much.
All right? Last but not least.
I guess. Okay. Some years ago, say around 1989, I was into a serious accident, right? And I never had asthma. I never had problem breathing, right? Now the breathing has come with the cough, and the cough is ridiculous. And when I go to the doctor and tell them that the cough is ridiculous and how long it lasts, it makes people, I draw attention. Someone will look at me and say, oh, she got TB or something. But I'm trying to find out
Now tell me, are you on any blood pressure medicines?
Yes.
Are you on anything called lisinopril or anything like
Yes.
that? Sometimes that can cause a cough.
Okay.
So look into that. Do you have sinus problems?
Since I've been down here, yes.
Yes, you've been out here. Sometimes sinus problems can also cause a cough. I would start with asking your doctor, hey, could this blood pressure medicine be causing my cough?
Okay.
I would start with that.
Okay.
And also, so if that doesn't work, do you have heartburn?
It's ridiculous too.
Sometimes heartburn can also cause a cough.
Okay.
So there are other things that can cause a cough that you can look into.
All right.
All right?
Thank you.
Stand up, St. Peter's. Thank you, Dr. Lamar, for being so patient and so sweet. I mean, you're just as patient as you can be. Thank you so much. I said, little smarty. I said, how does she think of all that stuff? So again, thank you so very, very, very much. And ladies, you might have a seat. We have something else we have to do very quickly. But please, I'm asking, I'm almost pleading with you. Go get your colonoscopies. Go get all your, go once a year to get you a checkup. Bishop and I are very religious about this. We do our colonoscopies together. Our children go with us. We go together. He's in one room and I'm in the next room. And we just go home together and sleep it off and come on back. So go and do all this. We do everything together. It was so funny. My children said I was delirious. I didn't even remember putting my clothes on. But it was so much fun for us just to do it together. So go out and do this. It's not half as bad as you think it is. And I went to the doctor for my yearly checkup, and I had no symptoms about some things. And they found some things, but praise be to God. We have such an awesome God. Everything's cool. Amen. I went, and just to catch it in just very quickly. So do this for us. And again, thank you. And thank you to your husband and your little boy who's in the nursery for coming and being with us. And all the speakers, thank you for coming. Ladies, please stop at the desk outside. Sometimes we hear these things and we just let it go right by us. Please don't do this for the sake of your family. Your family needs you. God needs you. Don't just pass out that door and say, oh, it's just another session. No, God warns us ahead of time. He really warns us ahead of time. We just don't listen. Please sign up. It's free stuff out here now. There's so many things we can do. And God bless you again, Dr. Lamar, for coming and being with us. And we're so very proud of you. Thank you for taking the time to go to school and learn these things to help us. God bless you. Again, one more time, give her a handshake and thank her for that. It took years to do this. It took hard work to do this. And we're just so proud of you. And thank you again so very much.
You know, 2000 and, you may have a seat. 2014 is the year of contagious generosity. God's divine progression through contagious generosity. This is our year. We believe in sowing where we find a great, something that enhances us. And St. Peter's, we are givers. And so therefore, we want to make a presentation to Dr. Lamar. Come on here, babe. If you stand there, Dr. Lamar from St. Peter's Church and World Outreach Center. Here's a check for $1,000 to Wake Forest Baptist Comprehensive Cancer Center Society from St. Peter's Church. Wait a minute, come on. From St. Peter's Church and World Outreach Center, because we believe in giving, contagious, come on beside me, son, don't have to stand behind me, contagious generosity. This is a church that believes in sowing, and we believe as a result of finding great universities, great people like you, you have given us information this morning that is beyond most people's comprehension. Given your time, your work, and your labor of love, we now present to you at Wake Forest University Cancer Center a check for $1,000. Yes. God bless you. Thank you.
Can I just say one thing?
Yes, you can.
You have no idea what this means to me. This actually is for our cancer patient support program, and this helps our underserved patients. Sometimes they even need food while they're having chemotherapy. So you have no idea. They're going through a hard time right now financially, and so our patients are so appreciative. Thank you so much.
Yes. Thank you. Again, let's give Dr. Lamar another great hand of applause. You know, information like that can save your life. There's no as I stated, information like this is beyond comprehension, but yet God has made it possible for us to have people who have studied, who's willing to come here and give their time to inform us of things we can do personally to prevent these things. And the sooner you discover things like this, the greater the opportunities of your chances of overcoming. I believe in doctors. We do walk by faith, but faith also tells us to go to the doctors. Yes, I go every year, get a physical. I get a colonoscopy every 3 to 5 years, because the first time I went, they found some polyps in my body, and that's the beginning of cancer. But yet, and I was going for about 4 years every year, but now they pushed me out. So I must be doing something right, whatever there. So I encourage you, St. Peter's, don't have so much faith that don't think that you don't need a doctor. We all need doctors. And if they tell us to take medicine, take that medicine by all means. And continue to trust God to bring total healing. Amen. A couple of things we want to call to your attention. Number one, you know, this is the time we are involved in our movement, 6 months of our family, developing our family. And Wednesday will be the first session for this month. It's a very important subject that we're going to discuss.